So she may make a little noise here. Let's see. All right. So if you have a Dolphin Neurostim, please do get it out, and we will go over all the features of it and how to use it. We're going to go over how to hold it, how to change the batteries, how to do scar treatments, how to find acupuncture points, and how to do vagus nerve stimulation. So we have a lot of ground to cover tonight. So starting at the tip of the Dolphin Neurostim here, we have a biocompatible alloy tip. You will notice that if you push on it, it is spring-loaded so it doesn't poke holes in your skin. And moving up from there, you will see a black button. And you'll notice if I press this button, nothing happens. But when I turn the unit on, I will need to hold this button down to begin my treatments. Up from there is a little roller switch, and this roller switch does several things for you. It's going to act as your on and off switch. It's going to act as the intensity control for the Dolphin Neurostim. It's also going to activate the battery test light for you so you can check the battery on here, and we're going to go over that in just a minute. So if I turn the Dolphin Neurostim on, you'll hear there's a tone, and when I turn it over, there should be a green light right here, and you'll notice there is not one. So if I turn this one on, you can see this one does have a green light. So an absence of green light tells you that the battery is about to be dead and you're going to need to change the battery. So we're going to go over that now so you guys get the gist of it. So you will notice on the back of the Dolphin Neurostim, there are two screws. There's a screw at either end of the Dolphin Neurostim. Please do not take these screws out. We have people try to take these screws out to change the battery. And this is the office fusses at me to make sure to tell you guys. Our number one customer thing we have to do is you guys have to send these things in so we can put them back together because you took it apart trying to change the battery. Now, if you look, there's a very conveniently located battery compartment door right there. So we're going to open that up. You're either going to need a quarter or a screwdriver or a pocket knife or whatever. So we're going to pop that open, and you'll see that inside is a 9-volt battery. To get the 9-volt battery out, if you just give it a little pop, you can pull it right out, and you'll notice there is a little graph in there that shows you exactly how to put your next battery back in. On the topic of batteries, there are 3 batteries that we recommend for the Dolphin Neurostim. We recommend Duracell batteries, we recommend Energizer batteries, and we recommend Panasonic batteries. Other than that, you're kind of on your own because these devices have a fixed size in the battery compartment. And oddly enough, not all 9-volt batteries are the same size. So AA batteries, AAA batteries, C batteries, D batteries are all the same size. 9-volt batteries can be a little longer or a little shorter. So if you put a battery in here that's too short, it's going to rattle around and you're going to get intermittent contacts, and it's really going to affect your treatments because about half the time you're not going to be doing a treatment. If you get a battery that's too long, there's actually a post down in here that you can actually break, and it'll affect the integrity of your Dolphin Neurostim. So if you stick to these 3 batteries, you're good. If you decide to venture out onto your own and try other batteries, that's kind of on you. But what I will tell you is don't use cheap dollar store batteries, because if you do, they have a really bad habit of dumping all their voltage very quickly. And when they do that, you can actually damage sensitive electronics with that. So just stick to regular batteries. One battery usually lasts me about 3 weeks here in a practice. And I use these every day, 5 days a week. So you'll get a lot of battery life out of these. We are testing some rechargeable batteries right now, but we haven't really reached a consensus on which ones are good. So I'm going to take a Panasonic battery. I'm going to slide it in here. And when you go to put the battery door back on, you'll notice it is a really tight fit. It feels like it's actually going to break, but it won't. It's just made to be a tight fit on there to hold the battery in. And then I'll turn the Dolphin Neurostim on again and check. And sure enough, I have a nice green light, which tells me that my battery is good. When that light starts to go dim, you do have enough battery life left to do a couple of treatments, but you do need to change the battery fairly quickly. All right. So moving up from this roller switch, there is also a little black button right here. So when I turn the Dolphin Neurostim on, check my green light, you'll notice that if I push this button down, it beeps and this light blinks. So that tells me that there's an ongoing treatment. Now, if I push this little black button right here, you'll notice the Dolphin Neurostim is silent, but it is blinking. So this little black button activates a constant treatment mode. So it's a timed treatment mode. And this will run for probably about 13, 14 minutes without you doing anything. You don't have to hold any buttons down. It'll just run. And when the number of electrons, because it counts how many electrons go to the tip of the device, when that period is up, it'll revert back to what we call search mode, and you'll get a steady green light and a constant tone. So if you turn your Dolphin neurostim on and press this button, you are now in a time treatment mode, and that's a hands-off thing. You'll typically have some electrodes attached to the device and be doing vagus neurostimulation or scar release or something like that. And while you're doing treatments, so turning it back on here, if you roll this switch up, the more you roll it, the more intense the treatment is. So when you're doing a treatment, you can actually adjust it on the fly to accommodate how sensitive your patient's skin may be. So to hold the Dolphin neurostim, we do recommend that you put your thumb on this metal plate back here. So that's really important. This metal plate allows the return flow of electrons. It completes the circuit. So if you do a treatment and you are treating like this, even though I'm pushing the button down, nothing is touching this metal plate. You are simply doing acupressure. You have got to touch this metal plate right here, or you will not complete the circuit and you won't be doing a treatment. The other thing you need to do is make sure you cradle this kind of like a pen in your hand. I see people trying to do some really odd kind of handholds on this. And unless you have really bad arthritis and just can't, we do recommend this because it's important when you start to find acupuncture points, motor points, and trigger points that you have the heel of your hand as a fulcrum so that you can move this around slowly and gently on the skin. If you try to come at it from straight above and don't have a fulcrum of some kind, you end up pushing down a little too hard on the device and you move a little too quickly and it becomes difficult to find points. So flipping to the back of the Dolphin neurostim, we have this metal plate right here. And unless you happen to have one of these little electrodes, one of these oval electrodes on this metal plate, then you need to be touching this anytime you're doing a treatment. So normally you would use your thumb, but if you have some arthritic condition in your hands, you might switch over and try it with a couple of fingers. All right. Up from there, we have two slider switches. You'll see one that says skin type, and you'll see that it says dry, normal, and wet. So this has to do with the sensitivity of the ohm meter in this device. This device does find acupuncture points, motor points, and trigger points for you. There's a built-in point finder. And it does that by measuring how conductive your skin is to electricity. Your skin is not a particularly good conductor of electricity. Actually, it acts as an insulator to keep your body's electricity in because you are electrical. But as happenstance or divine intervention or luck would have it, whatever you want to say, all the points on your body that are the most conductive to electricity happen to be acupuncture points, motor points, and myofascial trigger points. So if you have an electrician's ohm meter, you can run that around your body and you can actually find these points. So this device has an ohm meter built into it, but instead of having an ohm meter that is tied to a dial that you watch, it's tied into a light and a tone. So we'll go over that a little more in just a minute. But when you go to find points, you need to check your patient's skin or your skin to check for the sensitivity because this affects the sensitivity of the ohm meter. So if you have really wet skin, that's salt water, and that's going to be a very good conductor of electricity. So you actually want this device to be a little less sensitive. And so you would want to put it on the wet setting. But if you're somewhere cold and dry, like up in Canada or, in the Rockies or something like that, people tend to have drier skin. So in that case, you probably want to put it over on the drier setting, which is actually the most sensitive setting. And then, like I live down in the States in Georgia, it's typically fairly humid down here. Most of the time, I just keep this on the normal setting and it seems to do quite well. But in the summertime here, I will switch it out for the wet setting because I do have patients come in who are a little sweaty at times. Okay, one more switch on here. We have the polarity switch right here. And the polarity switch, the polarity slider switch, you'll notice has a plus, a minus, and a plus minus symbol on it. The plus symbol is the positive polarity, and that polarity is for tonification when you're trying to bring things up. So that's the middle setting right here. And so on the tonification setting, if you say had Bell's palsy and your face was drooping, then you would use that setting to bring the muscle tone up. Or from an acupuncture perspective, if you had deficient energy of some kind, so let's say you had deficient kidney chi and you want to bring your life essence up, which is your kidney chi, you would put it on positive. Now, most of the conditions that you're going to be treating are conditions of excess. So they're the things you want to bring down. Too much pain, too much muscle tension, active trigger points, shingles, strokes, heart attacks, asthma attacks, pain of any kind, autoimmune disorders, all those are things where there's not too little, there's actually too much, and we need to bring it down. So if you left this on the negative setting, on the minus setting, which is to bring things down, that would be the correct setting for about 98% of the things that you would end up treating with this. So if you go through our protocol books and look, you'll see that. There's also a plus minus setting on here, and that's a biphasic current. You're going to find that that comes in handy when we are treating scars. And if you take some of our advanced courses, we do a lot of in-person courses as well. So we do have scar courses and concussion courses and circuit courses and things like that. If you take those courses, you'll end up using that setting a little more that we're going to talk about tonight. But on the topic of finding points and doing treatments, it is, let me see what I'm looking for right here. If you look in any of the books that come with the device, and I'll just pick out one of the protocol books here. I'm going to look at a digestive pain and IBS protocol. You'll notice that next to each of the points on here, there is either a minus or a plus. So that actually corresponds with the setting on the Dolphin neurostim. So that will actually cue you for what your appropriate setting should be. Pardon me. Puppy drama. All right. So each of the protocols is going to have that on it. So you can follow literally, there's a protocol book that comes with your device. And if you have the vagus nerve book, the vagus nerve kit as well, you'll notice that all the points in there also have a plus or minus next to them. So that will be set up for you. All right. On to finding acupuncture points, trigger points, and motor points. Like I said, this device will find points for you. There are a couple of things you need to know when you do that. The first, like we talked about, is that you need to have your thumb on this metal plate. The other thing is, if you're finding points on yourself, that's all you really need to do. But if you are treating someone else, so I have an acupuncture patient here. If I were treating this patient, I need to touch the patient with the tip of the device, but my hand has to touch the patient's skin somewhere. So it can't touch a shirt. It's got to touch bare skin somewhere because the electricity has to go in and then it has to come back out and travel back up into this device to complete the circuit. So you can't really treat on top of clothing. It is possible to treat through clothing with this sometimes because you can get the tip of this to fit through the weave of, say, blue jeans or something like that. But even if you're doing that, you need to have some skin contact with your patient. So you either need to be touching them and touching this, or you need to have one of these electrodes connected to the device and then have a pad like this connected to your patient. So that connects you as well. So there are really two ways of going about doing this. And actually, that is not true. There are three ways of doing it. You can also have one of these. These are available. I think you can still get them on our website. It's called a double wrist strap. So you would put one of these on you and you'll see that it's got a little metal plate there. You just put it on your arm and you put the other one on the person you're treating. And that acts as your, we'll call it a ground. It's not really a ground, but that acts as your anode. So you'll have this on you and this on your patient. These are, I don't know, probably 25 bucks or something like that. If you look on the website, they are available. So those are the things you need to know to get into actually being able to find a point. Now, once you start looking for points, it is really important that you don't push down really hard with this device. So let me show you what happens if I push down really hard. You can see that wherever I push, the light goes out. Each time I push down really hard, the light goes out. So what I'm doing is I'm pushing so hard on there that I'm compressing the skin. If you compress the skin a lot, it actually becomes more conductive to electricity. So it's important that you use fairly light pressure when you're finding these points. So what I'm going to do now is look for an acupuncture point. So let's look for, let's get this set up for you. Let's look for large intestine 4. There's a point on your hand that people talk about. They say, hey, if you're having a headache, you can rub in the web of your thumb and it's good for headaches. Well, there's a point there called large intestine 4. It's also known as Hoku, which is called the Great Eliminator. And if you treat that point, it works for the anterior neck and face. So it could be jaw problems. It could be a tension headache. It could be a bloody nose. It could be any number of things on your face, toothache, whatever. We don't recommend that point for migraine headaches. It can be useful in migraine treatments, but it can also cause a rebound headache that is worse than the initial headache. So there's other points that are better for that. And if you want to make a quick side note, like if you're taking this course because you want to stop migraine headaches, don't treat this point. Treat a point called Heart 9, H9. There's a little extra hint for you. Okay. So to find large intestine 4, most people miss it because they go in the loose skin area right here, but it's actually more up in the flesh here. So if I take my hand like this and squeeze my index finger up against my thumb, or squeeze my thumb against my index finger, it creates a little mountain right here. And right at the top of that mountain, right here, should be pretty close to your acupuncture point. So when I open my hand, you'll see it right there. So now I'm going to turn the Dolphin Neurostim on. I'm going to check to make sure I have a nice green light so I know it's conducting well. And then I'm going to pull this across my hand here gently, and let's see what happens. All right, see the light goes out right there? So there's my acupuncture point. And I can go back to that point over and over and over again. And it's a fairly large acupuncture point, so it's kind of a hard one to miss. But each time you should get that same response. Now, you'll be tempted. So once you do this, once you found your point, you can then go and hold this button down on the front. And as long as you're holding this button down, you'll see that the light is blinking on here. But as long as you're holding this button down, you are doing a treatment. But as soon as you release this button, the treatment is done. Now you can hold the button down again and continue to treat, but you can't press this button and expect it to continue to treat. If you want to do that, you can press this little black button right here, and you'll notice it goes silent, but it is also blinking. So this will run for as long as I want it to. Okay, so that's the basics for finding a point. Let's find one more point here. If we look on the elbow here, at the end of the elbow crease, there's a point here called large intestine 11. It's a homeostatic point in acupuncture. So if I just pull my arm up like this, you'll notice that there's a little crease that runs across here. And right at the end of that crease, you'll find the acupuncture point, large intestine 11. And it's good for things like fevers. I used it a lot when my kids were little. And it's really a point you could apply in just about any condition because it's good for homeostasis. So I'm going to turn the Dolphin Neurostim on. I'm going to pull this across my skin. Let's turn it so you can see it. And you'll see the light goes out when I get on the point. If I pull up from there, not so much, but when I get on the point, the light goes out right there. And so you'll be able to find that point over and over and over again. So when you're looking for points, the hints I can give you are you want to go slowly and carefully. These are small points. So if you go really quickly when you're moving the Dolphin Neurostim around, a lot of times you'll just graze right over the point and the light will flicker, but you won't even notice it unless you've done this for a while. So my recommendation is go very slowly. Practice for a day or two. It doesn't take long to figure out how to use a point finder on here. I teach courses on this, weekend courses. I'll be down in Tampa this weekend teaching for HCA hospitals down there. And I expect by the end of the day on Saturday, everybody will be pretty proficient in finding acupuncture points. So play with it a little bit. You'll get the hang of it. Not a problem. There are some things that I should also tell you just to make your life a little bit easier. The light on here is incredibly useful. It tells you if the battery is good. It also tells you if you found an acupuncture point. And that's also very useful. But when you start doing treatments, you'll notice that even though I'm holding the button down here, it's not flashing. Now, if I turn the intensity up like this, you'll notice that the light is flashing. So sometimes when you're doing treatments, the light will flash and sometimes it won't. So my recommendation is there are 2 times when you want to look at the light on this device. The first is that when you're looking for acupuncture points, and the second is to check the battery. Other than that, if you look at the light, it's just going to confuse you. So I would just leave it alone. It's going to raise more questions than you're ever going to have answers for. And it's nothing of significance. The only significant thing about that light is helping you find points to treat and also to make sure your battery is good. All right. So the next thing we need to do is go over how to find well, not how to find, but how to treat a scar. This is actually one of my favorite parts of teaching this. I've been doing this for years. And as a therapist, um, as a therapist, I've worked in neurology and neurosurgery offices. I've worked with physiatrists. I've worked with a lot of people who've had some pretty significant surgeries. And I also used to do 1 day a week in women's health clinic. So I've treated a lot of back surgery scars, neck surgery scars, open heart surgery scars, hysterectomy scars, C-section scars, tons of scars. Scars do not lend themselves to releasing very easily. It's an electrical thing. If you want to release a scar, you really need to use some electricity to do it. So there are really 2 ways to release a scar well. One is by using electrons. You need 2 Dolphin neurostims to do that. And the other is a protocol known as neural therapy injection. We actually inject procaine into the scar itself because the electrical charge of the procaine actually repolarizes the tissue and changes the electrical properties of the scar itself. You can do manual therapy on a scar. I'm a manual therapist. It's not particularly effective. It takes a long time to get anything done. You can do it, but it takes a long time. You can do scraping, same thing. It takes a long time. You can do myofascial release, same thing. It takes a long time. So, but if you want to release a scar quickly, doing procaine injections or doing microcurrent is really the fastest way to do it. And we actually did some research. We let's see if I've got it in here. We actually had a doctor do some diagnostic ultrasounds for us, and he writes books on ultrasound, so he's a bit of an expert on it. But this is a breast cancer scar, and if you look from here to here, you can actually see the change in the scar tissue. So this is the beginning, this is the end, and you can actually see the change in the density of the scar. So once you have a scar, it's always going to be there. You can never get rid of it unless you have it cut out. And once you have it cut out, you're going to have more scar tissue. But you can change the properties of the scar itself. So what do I mean? Well, you can't break up a scar, but you can change the density of the scar. How do you change the density of the scar? What you need to do is flip the polarity of the scar. So normal body tissue has a negative charge. Scars have a positive charge. So if you can change the polarity of the scar tissue itself, then the density will start to drop. What we know from doing studies is that you get about a 24 point something percent reduction in the overall density of the scar with each treatment. And whatever you get out of that sticks. So if you release a scar by 24% today, you can treat that scar in 3 days from now, and it'll still be released 24% plus whatever you do then. Or you can release that scar today and you can do another treatment in 6 months, and whatever results you get will still hold. So whatever results you get, those are permanent unless you insult the tissue there in some way. Like if you create a new scar in the area, then you have the same problem over again. But other than that, once it's released, it's released. How old of a scar can you treat? I've treated scars that were 60 years old and they responded very well. You can also treat actually right after surgery. Now, you don't want to stick this in an open wound, obviously, because that's a dumb idea. But if you treat around the wound itself, you will actually increase ATP production by 400 to 500%. That's adenosine triphosphate. That's the mitochondrial fuel. So that ramps up healing tremendously. It'll also increase protein synthesis and cellular membrane transport. So you got a lot of cool stuff going on when you treat an open wound. And I've actually healed up some non-healing diabetic ulcers in friends of mine who went through wound care at the hospital and didn't get any outcomes. And because I didn't want them to have their foot cut off, I went to work on them. And I was actually able to get some tissue granulation and get those things to heal up. So it can be a very effective tool for that. And the sooner you treat an injury, the less the chances are you're going to have some scar tissue that causes problems. So what kind of problems can scar tissue cause? Well, there are a lot of different problems. Probably the number one reason people come to me for scar treatments is scars can be painful. So nerves run from deep to the surface, and as a scar forms, it'll wrap around those nerve endings that run up to the surface of your skin and it can cause numbness, and it can cause pain, and it can cause pain and numbness at the same time, which is weird, but it happens quite a bit. So if you can take the pressure off of those nerves, it really does a lot to reduce the pain. So my expectation is the first time I treat somebody, the pain of the scar should be reduced by at least 50%. Usually it's a lot more than that, but conservatively, 50%. But beyond pain, what other reasons would you want to treat a scar? Well, scars can be ugly, right? Scars can be puckered and raised up. Scars can be dipped in. And that's all because of the consistency of the tissue. And those will change with treatment. So if you're doing treatment for cosmetic purposes, you can certainly affect that with microcurrent. Other reasons to treat a scar, post-surgical scarring can often lead to swelling in your limbs. So you've got this lymph that moves through your system that has to get all the way back up to here before it gets dumped into your body. And if you have something like a big hysterectomy scar or a hernia repair scar or something like that, that lymph can't get past the scar tissue to get back where it needs to get dumped into your body. So you'll see swelling in feet and hands and all kind of stuff like that. Now, when you release a scar, that lymph isn't going to move through that where that scar is anymore, but it reduces the tension in the fascia enough that the lymph can now get by another place to get to where it needs to. So you have this covering around your body called fascia. So you got bone, and on top of the bone you got muscle, and between the muscle and the skin you've got this stuff called fascia, which is like a body stocking of connective tissue. So it runs everywhere on your body. Okay, so if you put a cut across here, then lymph, which moves through sort of potential space between muscles, it'll stop right here and you'll just get a toxic waste dump down in your legs and feet. But if you release that, then it can move its way around other areas to get back to there. Now, on the topic of fascia, fascia can also bind range of motion. So I have seen cases where people had range of motion issues that weren't necessarily close to where their scar was. So, for example, if you have somebody who has like a hip replacement scar right here, and if it was pulling down, so remember this fascia is like a continuous body stocking. There are different layers of it, but they all kind of work together. So if it was pulling down really hard right now, I've seen cases where people have range of motion issues in their shoulder because of the scarring farther down. And working in women's health, what I saw a lot was a lot of people with posterior neck pain and posterior back pain after C-section scars, because it tends to pull people forward and then they have to fight to come back up, and they end up with a lot of back pain and neck pain because of it. And the C-section rates in this country, it's the most popular surgery in the United States. Like 1.3 million C-sections are performed every single year. About a third of all pregnancies these days end up in a C-section. If you get up into New York, it goes up to almost 40%. If you get down to like Brazil, it goes to something like 50 or 60%. So the rates are very high, and there are definitely consequences from having that. I know that it has to happen sometimes, but I suspect that a lot of people are getting C-sections done because of either convenience for the doctor or themselves, or they're worried about their figure. And there are definite health consequences to those C-section scars. So you can get range of motion issues from scars. In the world of acupuncture, any scar that cuts through a meridian, so that's all these little lines you see drawn all over this doll right here. Those are all the energy lines in acupuncture, the meridians. Any scar that cuts through a meridian is considered to block the energy there. And you'll see some really odd effects. Like I've seen people who've had surgeries, and like 8, 9 months later, they start having anxiety attacks. And it's not tied to anything that they can, there's no trauma, there's no nothing. Except when you start tracking back, you'll find out that they had surgery like 6 to 9 months earlier. And usually if you go and you treat those scars, you'll find their anxiety level drop significantly. So scars can actually act as a battery for the sympathetic nervous system. So you've got the sympathetic and parasympathetic nervous systems. Your sympathetic nervous system is your fight or flight response. Your parasympathetic nervous system is your rest and digest functions. When you do microcurrent anywhere on an acupuncture point, whatever, it actually works on your parasympathetic nervous system to bring that up, to calm your system down, and to trigger your body to heal. But what it also does is it brings down the sympathetic nervous system. So if you have a cut somewhere on your body that turns into a scar, the scar itself doesn't conduct electricity well, but can hold a higher resting charge in the surrounding tissue. So normal body tissues like 80 millivolts, scars can hold a resting charge somewhere around 1.6 volts. So significantly more voltage in the scar itself. And you've got sympathetic nerve fibers all over your body, over about 90 something percent of your body. So if that scar has an excessive charge, it's going to stimulate the local sympathetic nerve fibers, not a lot, but a little bit every day, 7 days a week, 365 days a year. And it winds up your sympathetic nervous system so that you can have scars that aren't painful, that aren't affecting circulation that seem to have no effect on you whatsoever. But years later, you may have severe injury of some kind and your system is wound up, and that scar adds enough um, overall stimulation of the sympathetic nervous system that actually makes your pain worse. So I'll give you an example. A friend of mine popped her Achilles tendon and had to have it reattached. And she started having symptoms of complex regional pain syndrome, CRPS, which is a really, really, and it used to be called reflex sympathetic dystrophy, RSD. And it's really, really bad if you get it. Like people commit suicide when they get that. It feels like fire all the time. So when she went through her normal therapy, she really was having problems because this was starting to wind up and she was having weird nerve pains up her legs and it was just burning all the time. So the things we had to do to calm her system down before we could even treat that scar was we had to go through and we had to treat her C-section scar. She'd had a breast biopsy. We had to treat the breast biopsy scar. Once we got all those scars taken care of, her system was starting to relax some. So then when I went to the area where she was having problems, I was able to get a positive outcome. And we kept her from going into complex regional pain syndrome. And she seems to be doing well to these days. So that's all the ins and outs of what you get from treating a scar. But now we need to talk about how to treat a scar. So it doesn't really work very well to try and treat a scar with one Dolphin neurostim because scars don't conduct electricity well. Scars are basically, for all intents and purposes, non-conductive tissue. So if you try to put this directly on top of a scar, what's going to happen is that the electricity is going to just take the path of least resistance and go around the scar. And if you use pads with like a TENS unit and slap that over a scar, same thing. Electricity is like water. It always takes the path of least resistance. So it'll just go around the scar and won't really have a significant effect on the scar tissue itself. If you want to release a scar, you have to be able to play ping pong with electrons. That's how I see it in my head. You've got to be able to bounce these electrons back and forth through the scar tissue. And if you can get that to happen, what ends up happening is it electrically flips the charge of the scar itself. And now you have some tissue that's more normalized. And so it's going to respond much better to anything else you do after that. So how do we go about doing that? Well, since I don't have any big scars to show you guys, we're going to draw a little scar on the board back here. And we're going to go over how to do a treatment. So one of the scars that can cause a significant amount of trouble for people is an open heart surgery scar. So we're going to put a little person up here who is very unhappy because he has had open heart surgery. You can see he's just really unhappy there. Arm. Close enough. You can tell it's a person. We'll give him a little hair just to, make it look good. All right. So our person here has had open heart surgery and has this scar right down here. And that's a pretty brutal surgery. It'll save your life. But boy, I mean, they cut you open. Then they take a Black & Decker power saw and they run it right through your sternum and they cut that in half. Then they put these spreaders and they pull your ribs open. Then they got to get past you. Like, it's a big deal. So what I see a lot with those kind of patients is they have severe upper back pain, upper back and upper neck pain after those surgeries. And you can treat this area all you want. You can massage it. You can put lidocaine on it. You can do trigger point. You do whatever you want. But until you release this scar right here that's pulling them in, you're not going to see much improvement. So what do we need to do to treat this scar? Well, like I said, if we stick one of these pads over it, like this, and just try to stick a pad over it, what's going to happen is the electricity is just going to go around the scar. If we take one of these Dolphin neurostims initially and try and put it on the scar, it's going to touch the skin and kind of go around it as well. So we need 2 Dolphin neurostims, and there are specific settings for this that seem to work best. So you don't have to worry about the sensitivity of the ohm meter on this because we're not finding acupuncture points. Remember, this is pretty well non-conductive tissue. So don't worry about the bottom slider switch. Worry about the top one, though. You want one of them on the negative setting, and you want the other on the biphasic setting, which is this plus-minus setting right here. So now you're going to, the negative side, electrons are going to come out of the tip of the device, go across this scar and get pulled through by this one, because it's actually going to pull the electrons through. It's going to pick them up and it's going to throw them back across. So it's going to bounce them back and forth. So what it looks like when you're doing it, and this is, we do a whole 2-day course on releasing scars. So this is really sort of a crash course for you guys, but you will get some really good outcomes if you do just this. You can get even better outcomes if you put a little more work into it, but this will work quite well for you. It'll work better than anything else you have right now. All right, so you're going to go on either side of the scar, and you're going to count out 10 beeps. So when you hold that Dolphin neurostim button down, it's going to start to beep. So you're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And notice I'm not on the scar. I'm on either side of it. I'm going to go a 1/4 inch down from there and do the same thing. So I'm going to do this all the way down the scar. So when I get to the bottom of the scar, typically what I'll do is I'll switch the Dolphin neurostims from one hand to the other so I don't have to mess with the slider switches. And I will work all the way back up again, doing the same thing I did before, counting 10 beeps each time, all the way back up to the top. And then one more time, I'll switch it and I'll work my way all the way back down again. So that's 3 passes at 10 beeps each. Okay, so total you got about 30 beeps there. So what you're doing is you're just bouncing these electrons back and forth across here. Now, once you've completed that part of it, now you have some tissue that's a little more conductive in the middle. So now you can actually go treat on the scar itself. So what you can do is you can take your 2 Dolphin neurostims and you can put one at the top and one at the bottom, count out about 10 beeps, and then do the same thing, work your way through. And you can do this 3 times. And once you're done with that, you're pretty well done treating the scar. Yes, there are acupuncture points you can add. There's fancy things you can do using some of these cords and electrodes and stuff like that. But this is a really good basic scar release. Now, what happens if it's not a linear scar like this? Let's say that you have, because where I live, there are a lot of paper mills down here, and people get steam burns, and steam burns are nasty. Steam has an awful lot of energy and really burns deep. So let's say this guy has like a bad steam burn like this, and he's had skin grafts and all kind of stuff like that. What do we do in this case? Well, you're just going to start on either side of the scar like this, and you're going to work your way around the scar like a clock. And again, 10 beeps every single time until you've completed 3 passes. Then you're just going to work your way through the scar itself. And it's going to take a lot longer on a scar like this and on a scar like this because you're dealing with a lot more surface area. So expect that to take a little bit longer. Now, can you do more than 10 beeps? Absolutely. When I do scar treatments here in the office, I'll spend sometimes close to an hour working on certain scars on people. So you can certainly spend a lot of time doing it, but if you want to get a good scar release quickly, and so a lot of the people who use these devices work in physical therapy clinics and occupational therapy clinics and medical settings where everything is divided up into 15-minute segments. So somewhere along the line, somebody decided that your insurance will pay for 4 15-minute segments so that you get an hour of treatment, and that should make you better through some magic of that an hour. More than that, they don't really pay. Most insurances don't pay for that. So therapists need to be able to get through these treatments fairly quickly so they can do other things, manual therapy and stretching and ultrasound, whatever else they're going to do. So in 15 minutes, you can typically get a good scar release on someone. And you should expect the scar for the patient to feel better, like their pain should be reduced. The range of motion should be better. The scar will visibly change usually on the first treatment. So if it's red and puffy, the color will change. It'll lighten up a little bit and you'll see a lot less puffiness in the scar. So that's kind of the basics of the scar release. And we can certainly talk a little bit more about that later. But age of the scar doesn't matter. Location of the scar doesn't matter. And the scars that get people the most are usually the oldest scars. So I've seen crazy stuff. I've seen people have scars on the front of their shin. There's an acupuncture point on the front of your shin that's actually used for frozen shoulders. It's called stomach 38. It's right there. And I have seen a scar right by that acupuncture point affect shoulder stuff. So I've seen somebody with a frozen shoulder, they couldn't move their shoulder, and gone and treated the scar next to the acupuncture point for shoulder problems and seen the shoulder actually get better. So scars are really significant. And a lot of people, your patients will lie to you. They'll, tell you, oh no, I don't have any major scars. And then you start looking and you're like, well, what's this? Oh, well, that's where a bull gored me when I was 12. Well, how is that not significant? A lot of people have cosmetic surgery, so they'll have scars along their jawline, behind their ears. They'll have surgeries at the top of their eyes to pull their eyes up so their eyes don't droop. So look for those kinds of scars. Any kind of scar like that is going to be subject to causing problems for people, and scars in your scalp as well. So if you've had some kind of surgery up in your scalp, those scars count. And there are ways you can go about treating those as well. All right. So that's the basics of scars. Now we need to talk about what to do if you are treating someone who needs to have vagus nerve stimulation. So some of you, hopefully most of you, have a vagus nerve stimulation kit. And if you have that, now would be a good time to pull out the pieces for that. So let's talk a little bit about the vagus nerve to begin with. So what is the vagus nerve? Well, the vagus nerve is the longest nerve in the body. It's called the wandering nerve. It starts up in your brain, sort of behind your ears, comes down in your chest and goes down to your gut. More information goes from your gut to your brain than goes from your brain to your gut. And because of that, the vagus nerve is often called the second brain. So it sends an awful lot of information back and forth between the two areas. And it is intimately tied into a lot of different disorders. So if you start Googling things up these days, like people tend to do, you can Google up vagus nerve and Parkinson's disease. Back in the day, and I don't remember why they used to do it, they used to cut people's vagus nerves fairly regularly for surgical purposes. If you had that surgery done, you will never get Parkinson's disease. Ever. 100% never get Parkinson's disease. That doesn't mean that you should have your vagus nerve cut, but it just tells you there is a strong relationship between the vagus nerve and what happens in there. And some people say, well, it's because, bacteria or whatever works its way up the vagus nerve from your gut to your brain. Some people say it's the amount of stress stimulation on the vagus nerve that triggers it. We don't really know. But what we do know is that if you stimulate the vagus nerve properly, you can significantly impact someone's health. So how do we know that? Well, there are some scientific measures we can look at. So one of the big measures these days that people look at is called HRV, heart rate variability. So let's get a little thing going here. So if you don't know anything about it, I would spend a little time reading up on HRV, which stands for heart rate variability. There's literally tens of thousands of studies on heart rate variability, and everything from athletics to longevity. It's actually one of the few variables that's actually tied to long life and longevity. The better your heart rate variability is, the longer you're going to live. As a matter of fact, let's see, I actually just gave a talk on that. So if you look at heart rate variability over time, your heart rate variability starts pretty high when you're young, and you'll see that it just degrades over time. As you get older, it just gets less and less. And over here, you'll see cortisol levels, and your cortisol starts pretty low when you're young. But as you get older, you see in the early 20s, this is usually where people are having children and starting their careers, your cortisol spikes here, and then you kind of settle out for a little while. And then as you get older, your cortisol just skyrockets. It goes through the roof. And somewhere at the end of this line, you die. So notice when this is low, you die. And when this is high, you die. Okay. Like that's really significant. So what we want is for your cortisol, you need cortisol because it's important, but you don't need too much of it. because it's an indicator that your system is stressed. So we want that number to go down and this number to come up. The higher your heart rate variability is, literally, the healthier you are. It's a measure of total power. It's a measure of how well your sympathetic nervous system can respond to incoming stressors, how well you can fight things off. And that, it could be somebody yelling at you. It could be some disease like COVID. It could be like, take your pick, crappy food, whatever. All those are stressors to your system. And the higher your heart rate variability is, the better you're able to deal with those things. Now, it also is a measure of the ability of your parasympathetic nervous system to heal you once you've had these problems. So you guys may have heard of a stress test. So let's say that you need to have a hip replacement and you go to the hospital and they say, well, before we do a hip replacement, we want to do a stress test on you. So what do? Well, they put you on a treadmill and they do all this stuff to stress your system. One of the things they look at is heart rate variability. If that number stays nice and high, meaning, and it's not your heart rate, it's the time interval between beats. If that number is able to vary and stay high, like, you're clear. If that number is low, like if that number doesn't change when you stress your system, those are the patients who will probably end up not being able to have surgery, because those are the people, if you put them to sleep, they're probably going to die. Oh my gosh, dog. All right. It's like having a child. Behave. So anyway, you want to look at this number. Even Sleep Number beds these days will measure your heart rate variability. The Aura rings will measure it for you and give you an idea what it is. It's a good thing to track. The other variable that's interesting to look at when it comes to this kind of stuff is your high frequency vagal tone, and that's called HFF. And all these are numbers you can pull from a, that didn't come out very well. All these are numbers you can pull from an EKG. So a good EKG can actually give you these numbers. Let's do this so you can see that. So if you want to do a little homework, you can look up high frequency vagal tone and heart rate variability. So what do we know? What we know is if you do vagus nerve stimulation with microcurrent properly, you can significantly impact these numbers. You can bring both of these numbers up, and you can actually make it stay up. So that means increases in athletic performance, because it's kind of crazy. You can sit in your chair at home and do vagus nerve stimulation and actually become more athletic. You can increase your exercise tolerance just by doing vagus nerve stimulation. So it doesn't replace workouts, but it will prime your system to perform better when you're doing athletics. It's a really cool thing. And if you are somebody who trains really, really hard, what you find is there's a tendency to go into what's called OTS, overtraining syndrome. And in overtraining syndrome, your heart rate variability drops so low that you can't recover. So it doesn't matter how much you train, you won't get faster, you won't get stronger. But if you do something like vagus nerve stimulation, it resets that. So what are some real world applications, before I show you how to do this, what are some real world applications of vagus nerve stimulation? Well, I can use myself in this example. When I had COVID, my oxygen saturation went down to about 90 or so. It was not great, but it wasn't awful. Like, I felt bad, but like I was hanging in there. But then one day I woke up and my oxygen saturation had gone from 90 down to about 80. And I felt really, really bad. And that is really significant because I raised 2 children by myself. And when your oxygen saturation gets down around 80, that's a trip to the hospital. And I really didn't want to spend any time at the hospital. So I had to figure out what to do. So what I did was I got my vagus nerve stimulation kit out and set it up and put it on. And I had to actually have my kids bring it to me. I was so weak. And so I did vagus nerve stimulation for about 2 hours. And after 2 hours straight of doing vagus nerve stimulation, my oxygen saturation went from 80 back up to about 90. So I was able to bring it up 10 points. And that's back when the Delta variant of COVID was around. So it was pretty significant. So I was really, really glad to have had that then and there, because it really kept me, for sure kept me out of the hospital, but possibly kept me from getting a life-threatening situation in the hospital. So, but I also use it on a fairly weekly basis. So here's like a kind of a profile. I'm 53 years old. I raised 2 kids by myself. I work 10-hour days. Like I start at 8 in the morning and I finish at 6 at night. I don't take breaks. And I travel some weekends to teach or speak at medical conferences. So I stay very busy and my job doesn't end at 6 o'clock. Once I get home, I'm feeding kids and doing homework and that kind of stuff. So my system tends to get pretty overwhelmed at times. So that was great when I was 40, but now that I'm not 40 anymore, I really start to notice it about the middle of the week. I really start to drag. But if I do vagus nerve stimulation a couple of times a week, what I find is that for about 30 minutes twice a week, I find that I don't have that. So it makes a huge difference in how I feel overall. So for me, that's about right. Now, if you're a performance athlete, you would probably do it a lot more. If you have an autoimmune disorder of some kind, because one of the things that doing vagus nerve stimulation will do is halt the production of pro-inflammatory cytokines. So it actually brings down systemic inflammation. So if you have any kind of systemic inflammatory condition, you want to do vagus nerve stimulation. If you have a lot of anxiety, vagus nerve stimulation is also quite useful. As a matter of fact, we actually had to make a modification to these devices some years ago, because what was happening is people would put on the vagus nerve stimulation part of it and get in bed at night and it would just knock them out. And then they would do vagus nerve stimulation for like 6 or 7 or 8 hours straight because the Dolphin nerve stim was still running. So now that's why we have this time feature on here. That's why you have this little button right here, so that after about 15 minutes, this thing will turn itself off. So if you happen to fall asleep, you're not going to do vagus nerve stimulation all night long.
Okay.
If you do that, what you find is you end up getting really, really, really tired the next day because it brings your system so far down. It's not going to hurt you, but it's going to make you pretty draggy. All right. So how do we set it up? Well, we need a Dolphin Neurostim. We need one that turns on and works. We need one of these black cables like this. And you'll notice that it has a little shiny metal plate in there. So that shiny metal plate needs to touch the tip of this device. So if you watch what I'm going to do here, I'm going to put it on firmly like this. And I can check to make sure I have a good connection. So I'm going to turn the Dolphin Neurostim on. You see that I have a green light there. If I take the tip of this and put it on the metal plate, you'll see that it goes out because I've completed the circuit. So that's how I know that I've got a good connection there. All right. So next, I'm going to need one of these little oval electrodes. Now, I do recommend that you clean the Dolphin Neurostim really well before you use these electrodes. These are expensive. These are relatively, cheap to get. These are not, because we have to specially have these cut to fit your devices. So take an alcohol wipe, clean off the metal plate on here, dry it off really well, and take one of these oval electrodes and stick it on that little oval area on the Dolphin Neurostim. So we're going to go like this. Doesn't matter which direction it's sticking in, just needs to be on there firmly. Now, as long as that metal plate is clean and doesn't have any oil from my skin on it, I can use these little electrodes over and over and over again. These are never going on anybody's skin. So once I'm done with it, I can take this and just put it back on this little card and I can salvage it. So now that we have these on, we need one of these little white cables, which comes in your Dolphin Neurostim kit. So you will notice with these white cables that it looks like a male connector and a female connector, but it's not. If you look inside, you will see that this is actually a shrouded male connector. So these are both male connectors. Just some hospitals require us to have this little shroud on there. So we're going to take one of the ends of this white cord and stick it right in here. Now, when I turn the Dolphin Neurostim on, if I take these two cords and put them together, the light should go out. So I'm just checking it to make sure that I've got a good connection there. And you guys are going to get a link, by the way. If I didn't mention it, you guys are going to get a link tomorrow so you can watch this over again as many times as you want. So if you get frazzled right now, don't worry about it. You can go back and watch this again. All right. So now I have my 2 cords connected. So now I'm going to need one of these. There's actually a card that comes with your Dolphin Neurostim that gives you some very helpful advice. And on one side of the card, it's going to show you where to put the sensors. And on the other side, it's going to show you something about the ear clips. So as a general rule of thumb, you want to use the left ear. Let me grab one of these clips here so you guys can watch what I'm doing. All right. So your Dolphin Neurostim comes with some ear clips. Some are black, some are white. If you look at the black ones, they have a little metal pad on them. My preferred ones to use are these. And if you look, these have like a little dome right here on them, a little rubber dome. So this is conductive rubber. Now, when you use these, you do need to moisten them. So I recommend using a little dab of ultrasound gel. Even water will work, or even if you have alcohol wipes, a little bit of alcohol in here is usually a pretty good conductor. I use a product called 1020. You can get it on Amazon. They do not have it on the Dolphin Neurostim website. Don't call them and bug them about it because they don't have it. But a tub of this will last you for forever. You need just the tiniest little bit and just put it on there. So this connects, you'll notice this has a black tail on it. So this black tail connects to the black cord, and the white tail of these electrodes connect to the white cord. So it's all color coded for you. And you're going to want to put this ear clip on your left ear. That's mostly what we're going to do. And we know from some very recent studies, some MRI studies, that the closest access you're going to get to the vagus nerve is not the ear lobe. That's certainly a place you can use, but this is actually not innervated by the vagus nerve. It works okay, but the best places are the inside of the tragus. So this little floppy thing right here on your ear, like if you were to push on your ear right here and close your ear, this is the tragus. So on the inside of this is a really good place. But you'll notice that when I put this clip on there, it has a tendency to just kind of slip right off. So when I put that in there, it just slips off a lot. So this is the most innervated place in the ear by the vagus nerve. But the second most innervated place is the upper concha of the ear. So that's this area right up in here. So if you put your finger on this little flappy thing and pull it back and up, you're going to end up in the upper concha of the ear. This dome electrode is actually designed. We had this specifically designed to fit the upper concha of the ear like that. Okay. So when I put this on, it's going to go like this and just sit right up there in that little hollow. Then I'm going to take one of these electrodes, and according to the card, depending on how you want to do it, you can either put this on your left wrist right here, and there are 3 acupuncture points right here that are called the golden triangle in acupuncture. They're really good calming points. Or you can put it 4 fingers below your belly button. So you just go to your belly button, you measure 1, 2, 3, 4 fingers, put it right there, and then you're all set up. So once you have your setup, and I do recommend you trying both of these, try your left wrist. The other thing is, before you put these on your skin, take an alcohol wipe, assuming you're not allergic to alcohol, and clean your skin really well. And if you do that, if you clean the oil off, when you put this electrode on, you can reuse it later. But as soon as you start getting oil on the black side of these pads, they don't stick particularly well. So clean your skin well. And then when you're done, you can take it off and put it back on. I have pads like this that I've used for a couple of weeks at a time on myself. Now, obviously, I wouldn't use the same pads on different patients. But if you had somebody coming in, once a week or whatever, you could use the same pad till it didn't stick anymore, and that would be fine. So you're going to put that on. You want to put the Dolphin Neurostim on the negative setting. So slide it over to the minus setting. You're going to turn it on. And then I got a good connection there. You see that the light goes out there. So now I'm going to press this little black button right here. and the Dolphin Neurostim is going to be in this timed treatment mode. So it's going to be completely silent. At this point, I can read a book, I can wash the dishes, I can do whatever. And this is fine. And as soon as it's done, it's going to go back into the search mode, and you're going to get a steady tone like this. Now, at that point, you can choose to either do more. So you could push that button again and do another 13 or 14
Okay, we gotta go.
treatment. Or you could say, like, hey, I'm done for the day. So how do you know how much treatment to do? Well, we recommend people start with about 5 minutes. So do a 5-minute treatment. That's what we do here in the office. If we're going to send these home with patients, we do a 5-minute treatment and we see how the patient responds. And then we base our recommendations on that. So what we tell people is add 5
Okay.
minutes each day to your treatment till you hit somewhere between 20 and 30 minutes.
Come on, guys.
I do
Come
recommend
on, guys.
doing this in the evening. If you do it in the evening, it's going to calm things down a bit. If you do it in the morning, it might make you a little draggy. Now, if you are doing this because your energy levels are low, then you might want to take the Dolphin Neurostim and put it on your right ear. So if you put it on your right ear, put the electrode down below your belly button and put it on the positive setting right here, you can use it to bring things up a bit and elevate your energy. So the way I typically use this is I use a negative polarity on my left ear in the evenings, or after a workout, and I use a positive polarity first thing in the morning when I'm going to rev my system up. But I do recommend not doing the right ear treatment with positive in the evenings unless you just like staying up all night long, because some people are very sensitive to this, and you will find that it will make you really wired up sometimes. Now, some of you are going to do this and not notice a significant difference until you do this several times. And after several treatments, it'll start to calm your system down. But try not to overdo it. It's not going to hurt you, but it may make you feel a little bit draggy. And everybody has a different sort of threshold for where their system starts to swing in the opposite direction. So approach that carefully, because this is a nervous system and we don't want to overload it. We want to calmly bring your system into sync for where it needs to be. You don't want to throw a bomb at it. You want to just gently do this. And it does work quite well. And we've got some pretty good studies on it. And if you study vagus nerve stimulation, you study heart rate variability, you will see that when you do this over time, if you do this consistently, you will see significant changes in your system. It's a really, really nice tool to use. All right. That's kind of the end of the vagus nerve stimulation segment. There are some things we need to talk about with this device. I forgot to mention, when you are treating scars, I do like to, there's an essential oil that seems to help things out a bit. And there's a guy down in Florida who puts this together, and his information is on the back here. Let me see. Gosh, I'm gonna put my glasses on. You probably guys can't see it. So let's see here. It's called Other Worlds. So I'll write this down. And the phone number is 954 654 6427. Guy's name is John. He's super nice. A little roller thing of this will last you a long time for treating scars. It just takes a dab, and it seems to accentuate the treatment a bit. He gets really pure essential oils, better than what you could get with doTERRA, Young Living, or any of those. Like, he gets his, like, he's got somebody who basically squeezes the stuff out for him. So it's a really nice little thing to use. Other things you probably need to know about the Dolphin Neurostim. There are some contraindications with this. So we need to talk about the things. We've talked about what you do want to do. Let's talk about the things you don't want to do. And so the first rule is what I call Joe's rule of pencils. Don't stick this anywhere you wouldn't stick a pencil. Don't jam it up your nose. Don't shove it down your ear. Keep it out of your eyes. Keep it out of places you wouldn't stick a pencil. That includes open wounds. Now, places that you also don't want to put this. You don't want to put this on top of your head right here, if you happen to have a history of seizures. So this point up here called Bai Hui, it's a governing vessel point, governing vessel 20, is actually contraindicated with needles in acupuncture for somebody who has a history of seizures. And this is electricity. So you don't want to put that directly where somebody is having, because if they have a history of seizures. Now, there are acupuncture points that stop seizures. There's a point on the bottom of the foot called kidney 1. I have seen it do a marvelous job of stopping a seizure. It works quite well, but just don't use this directly on top of the head. You want to avoid this point on top of the head as well if you are pregnant, because it pushes energy down. And when you're pregnant, you're trying to keep energy in, not push it out. So while we're talking about pregnancy, there are some other points you don't want to treat. You don't want to treat on top of the shoulders. That pushes energy down. You don't want to treat large intestine 4. This is the great eliminator point. So we don't want to eliminate your pregnancy. You want to avoid the inside of the ankles. So right in here, there is an acupuncture point called spleen 6. And I have used that working in women's health to induce labor. Now, don't get bent out of shape if you do a treatment on a friend and they're like, oh my gosh, I just found out I'm pregnant. You're not going to eradicate the pregnancy by treating one acupuncture point. But it is a useful point if somebody is close to time to start their delivery. It can speed up the process. But I wouldn't treat it on somebody consistently if they were just pregnant. I would just stay away from that. It's contraindicated in acupuncture, so you should stay away from it. Don't treat inside your belly button. Around your belly button is okay, but inside the belly button is prohibited in acupuncture, so that's something you don't want to do. Plates, screws, staples, artificial knees, artificial joints, Harrington rods, plates in your skull, all that's fine. Not a problem there. Dorsal column spine stimulators, fine. Baclofen pumps, fine. Morphine pumps, fine. Insulin pumps, fine. Like all those are good. Pacemakers and defibrillators, those are not prohibited with electrical devices, but they are a cautionary statement through the FDA. So I'm not a doctor. If I have a patient who has a defibrillator or a pacemaker, there is in the little book that comes with the Dolphin NeuroStem, you'll notice there is under the flap. Let's see if I've got one here. I can show you guys. Let's see, a lot of books here. Here we go. So when you open the case, there is one of these in there. It looks like this. And inside here, there is, what's this, page 3. You have actually the electrical parameters of the device right here. So you can shoot these over to a doctor, to a cardiologist, and they can say yay or nay on whether or not you can treat their patient. And whatever they say, that's what I go with. Other things to avoid. Don't treat over active cancerous tumors. That is considered to be a contraindication for any kind of electrotherapy. Now, that is being challenged these days. There actually is an FDA-approved microcurrent treatment, and this is microcurrent. This device is not approved for what I'm going to tell you about, but there is an approved microcurrent treatment for treating glioblastomas in the brain, which is a very aggressive brain cancer. And that therapy does actually shrink the tumors. Now, these don't have that particular medical indication, so I can't tell you that it's going to do anything for that. But what you don't want to do is you don't want to increase ATP production in an area of uncontrolled cell growth already. So, they say be cautious about that. Now, treating somebody with cancer, like that's if you're going to treat points for nausea during chemotherapy or whatever, that seems to be fine. I used to work, there was an oncologist on the floor above me, and he would actually send patients down for me to treat acupuncture points on before they had chemotherapy because it kept them from having nausea. So he didn't have a problem with that part of it. He just didn't want me treating around tumors. Other things, small children, fine. Just turn it down a little bit. Pets, fine. I've treated horses, dogs, cats. Cats have to be pretty sick before they let you treat them, but it does work. And if you want to find out how good you are, just go treat an animal. There's no placebo response in animals. They generally don't want you doing this to them. So if they can't walk when you start and they can walk when you are done, you did a good treatment. They don't expect to get better. They just want you to stop doing it. So if you get a positive response from an animal, that means you're on cue. So, if you want to see how good you are, go treat an animal. All right. Other things. Let's see here. What do I have in my little bag of tricks? We need to talk about these. Okay. There is, with the Dolphin Neurostems, an extension probe that looks like this. And you will notice again in the metal cup, there's a little shiny plate there. It needs to fit over the end of the Dolphin Neurostem. The cool thing about these is these are bendable. You can put them in whatever shape you want, and you can bend the back. So you can actually use this to treat points in your back if there are places you can't get to. So you can do this and just hold it down and treat yourself. You could even tape this to a back scratcher if you wanted to treat points farther back. Now, we do have some physical therapists who do TMJ work. They do use these for treating inside the mouth. That's not what they were designed for, but that is how they have used them. When I was working in women's health, we would use these to treat episiotomy scars because there are certain places you don't want to put this. And we would actually make the patient buy 2 of these. They're about $25 a piece. And we would treat the episiotomy scars and, numbness, painful intercourse, and urinary incontinence would usually clean up in just a couple of visits. So it really did make a huge difference. Like I said, these are, you can buy these on the website. They're about $25. I think they're under, just look up extension probe, but there should be one with your kit. And again, clean the tip with alcohol. You're good. Oh, when you clean these devices, do not pour liquid down into this tip. Okay. There's a conductive medium down in here that helps the device out. Clean these with an alcohol wipe. If you pour anything down in here, it will interfere with the conductivity of it. And then you're back sending it back to us to have it fixed again. So just clean these carefully on the outside. Other things. I think that's all the major things that we need to go over. And we have some questions here that we probably need to answer. So let me get my glasses on and look at the chat section. Okay. Does this work on scar tissue that is inside the body? It absolutely does. One of the things that is a huge benefit for this is that deep abdominal adhesions. So here are the numbers. If you have abdominal surgery, if you have one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. So that scar tissue that runs beyond the boundaries of the incision itself, it'll wrap around your organs, it'll attach to the back wall of your abdomen, attach itself to your psoas muscles, cause all kinds of restrictions and problems. If you have 2 abdominal surgeries, it's 100%. You're not getting out of it. It doesn't matter if you've been cut or if they sucked your gallbladder out through a straw, you still have scar tissue in there from that. Okay. So it will go well beyond that. So it doesn't really matter what the incision looks like. It's the fact that you had abdominal surgery. When your body thinks your entrails are going to become your extrails, it just flips out and starts laying down scar tissue. And it does it very haphazardly and can really cause some problems. So if I were going to treat deep abdominal scarring, one of the things you can do is you can take one of these little white cords that we already have here. If you've got the vagus nerve stimulation kit, you can take one of these white cords. You can attach this electrode to the back of here. You can take an electrode and you can, let's say I'm doing an open heart surgery scar or an abdominal surgery scar. You can stick an electrode on the back and you can treat through the body like this. Okay. So now I'm treating a scar, not just in 2 dimensions, but I'm treating in 3 dimensions. I'm treating back and forth, and I'm also pulling electrons through that deep scar tissue. So you can get all that deep stuff. If you were doing a knee, you would just take this electrode, slap it on the back of the leg right there, and then treat all around your knee replacement scar to draw your current through there. So it doesn't really matter where the scar is. You can use that same technique. Do be cautious about anything around here. You don't want to stick sharp things around your carotid artery. It's not the electricity, it's the pressure. If you start messing around with the carotid artery, you can make somebody pass out. So do avoid the carotid artery. As a general rule of thumb, stay behind the sternocleidomastoid muscle. But I have treated thyroid scars and stuff in here without any trouble. I just stay away from the carotid arteries. All right, let's see what else we have here. I missed it. Is the polarity setting negative on one side and positive on the other for scar treatment? All right. So for scar treatments, you want on one side, you want negative, and on the other side, you want biphasic setting. So, this is Dolphin neurostim number 1. This is Dolphin neurostim number 2. Doesn't matter which one's on which side. You just want to make sure you have that particular setup. And that's going to give you the best outcomes. Let's see what else we've got here. Oh, a lot of people answered that question. All right. Can you buy a single device, already have one, and treat your own scars? If I already have one. Yes, you can buy a single device. You can actually get on there and order a single Dolphin neurostim, and then you have 2 for doing your scar treatments. Can you treat a scar on the front of the neck? Yes, you actually can. You just I put a pad on the back of the neck to draw the current through. Can I expand a bit on treating people with cancer? It's only near the tumor that we cannot treat. Okay, so I'm not a doctor, and I can't tell you how to use this device on anything having to do with cancer. Now, if you want to know what I did when my sister had breast cancer, personally, I took these devices and I treated where her tumors were, and I treated the incisions after she had biopsies and after she had partial mastectomy stuff done. So I used it a lot on her, and I did a lot of vagus nerve stimulation on her as well. But that's me, and that was what I chose to do. So you can make your own decisions. Like I said, according to the FDA, you shouldn't be treating overactive cancerous tumors, and you need to be careful treating cancer. But we do know that if you reduce somebody's overall stress level, it's good for helping your body fight off cancer. Okay, so let's just kind of leave it at that. So let's see what else. Can you use the Dolphin on a client while their feet are in water? Yeah. If you're doing like a detox foot bath on your patient, yeah, that's fine. Not a problem there. Do you need the grounding for scar release therapy? You mentioned we needed to place one hand on someone for treatments to ground, but you didn't mention the grounding for scar release therapy. Yes. When you are treating a patient for scar release therapy, you need to have, if this is your scar, you need to have your thumbs on the metal plates. You need to have some skin contact with the patient. Now, the patient could grab your arm. You could use one of these double wrist straps. You could do that, or you could attach one of these to your patient and be fine. Any of those will work. Let's see what else we've got here. Would it help with blood cancers like leukemia? I haven't treated anybody with leukemia. I can't say anything having to do with cancer, but if I had leukemia and I wanted to lower the overall stress levels of my body, and we're trying to reduce inflammatory responses, I would probably do it to myself. When starting vagus nerve stimulation, is it best to do it every day or skip a day? So when you first start doing it, I would do a 5-minute treatment. Oh my gosh, dog. I would do a 5-minute treatment, and then the next day I would add 5 minutes to it. Now, if I found that I started feeling a little like tired, then I would back it off a little bit. Like for me, I use it twice a week and that seems to be fine. But let's say you had something like toxic mold syndrome. I've had some friends who've had toxic mold syndrome. And so there are all kind of protocols you can do for mold, but a lot of those protocols don't work because your system is so suppressed by the mycotoxins from the mold and it needs a boost. So in that case, you're going to be doing vagus nerve stimulation every day for an hour or 2 a day for weeks on end to get your system primed to fight this stuff off. So that kind of thing really makes a big difference. So it really kind of depends on what your condition is. But again, go slowly as you're building it up. You don't want to overdo it. You know, if you feel like you need to use this every day, that tells me your system is already pretty taxed. So what you're going to do is you're going to raise your heart rate variability, but you're going to lower your stress response so low that your body actually has to bring it up a little bit to level things out, and that requires effort. So you don't want to stress your system out any more than it already is. Okay. What else have we got here? Any cosmetic benefits to using a single device or two devices? Yes, there are whole acupuncture facelift protocols. Think about, so one of the things this does is this relaxes muscles. So if you get Botox, what does Botox do? Relax muscles. Where do you inject Botox? Inside a wrinkle. What if you put this inside the wrinkle? It relaxes the muscles, and then the wrinkles don't look as sharp. They're not as deep. And there are whole ways, like if you've got dark puffy circles under your eyes, that's depleted kidney energy. So you need to tonify your kidney energy when you wake up in the morning, and you'll find that the puffy circles go away very quickly. Dark circles under your eyes, that's a manifestation of liver. So there are a lot of cosmetic applications for this. There are whole acupuncture facelifts for this that work quite well. That's like a whole class right there. Let's see what else we've got here. How often can you treat scars? You could treat scars every day if you wanted to. So the scars continue to improve for about, once you do a treatment, for about 48 to 72 hours afterwards, you see continuing changes in the scar, and then it kind of levels off after that. So I would say leave a day or so between treatments. But if you're in a crunch, so I have people sometimes who fly in from far away to get treated by me. And I may have a week with them. Well, if they have scars, I'm going to treat those scars every single day. And that seems to work pretty well. I would just prefer to have more time to do it. That's all. Do I have any recommendations, protocols for long haul COVID? Okay. And chronic fatigue syndrome. So these devices actually in Canada, through Health Canada, which is the FDA in Canada, were actually approved for acute respiratory distress with COVID, and they also had emergency approval for long haul COVID. So they were actually used by patients up in Canada for those things. Now, all those emergency authorizations have lapsed and stuff like that. But if you have long haul COVID, you want to do a lot of vagus nerve stimulation. It takes a fair amount of that. And you want to do a lot of the parasympathetic calming points, which you will find in your books that come with these devices. Let's see. Let me look at the protocol book here real quick and see what would be some good ones. Let's see here. We have let's see here. On page 11 of this book, you'll see it says 3 parasympathetic points in the wrist, and it shows you the location of those. Those are really good ones to treat for long haul COVID. Some of those are lung meridian points. You're also going to want to tonify your kidneys. You are probably, so that's using a positive polarity with this. You are probably wanting to treat parasympathetic calming points in the feet as well. If you're still having respiratory distress, I would use lung 11 here at the corner of the thumb. That's for acute respiratory distress. That seems to help out with when things flare up. And then I would post a comment. One of the things you guys are going to get tomorrow is you're going to get an email from the folks at the Dolphin Neurostim home office that's going to invite you to join our Facebook forum. Please do that. That's a great place to get more information. You can type questions in there, and people who do this all the time get on there and answer questions for you. I get on there some, other instructors do, and we'll answer questions for you. You can also, find out there's somebody in your area you can practice with, or you can come, let's say you can't get to your back, maybe they can come treat your back for you or whatever. But it's a really good resource to have, and they'll also inform you when there are upcoming workshops. And so there are Zoom tutorials like this, and you can attend this again if you want to. Who knows? Maybe I'll be wearing a different color shirt, and I may say things a little differently. We also do some live trainings online, and we have some pre-recorded trainings online, and we do live workshops as well. So they'll update you when those are coming up. They're not going to bombard you all the time, but they will kind of let you know what's up and coming. All right, let's see what else we have here. For skin, for scar release therapy, you mentioned waiting around 10 beeps, but the beep speed on negative and biphasic are different. Should we go with the slower beep speed versus faster? Yeah, go with the slower beep speed. You'll be fine. Like don't overthink it. That just kind of gets you in the right time sequence. 10 beeps is roughly 5 seconds because these are somewhere around 2 hertz or something like that. All right, let's see what else we've got here. Well, that is all the questions, and we are at 8:56. Does anybody have any other questions? Like if you guys want to ask something, if you want to unmute your microphone and ask a couple of questions, now would be the time to do that while we have a couple minutes. Any more questions? You guys got it all down? Holy smokes. Okay, what's that?
Hopefully I won't get my hand smacked for asking this, but how common is it to not feel or see results or feel less pain with this?
Fairly. So in my practice, like you would need to look at what specifically what you're treating, but if you kind of averages out, my expectation is that in about 90% of my patients, I should get a positive outcome. Now, I have been doing this a long time, so there are lots of little tricks that I know that you guys don't, but it's pretty uncommon not to get outcomes. When I don't get an outcome in a patient, there's always a reason why I don't. Like there's a scar I missed, there's some underlying health thing that the patient, like I've had patients a couple of times that when I treated them actually got worse. They hurt worse when I was done. And in both of those cases, we found out that was actually what got the patient to go see the doctor, and we found out they had lung cancer. So sometimes there's a deeper thing going on that you stir up a little bit, and it leads to finding out other things that are going on. So it's scars. Scars will almost always, I can't really think of any scar that I've treated that didn't really respond positively to this treatment. I mean, these things will even affect keloid scars. It's not going to completely get rid of them, but it will shrink them down significantly. But if you do have a specific case in mind that you're looking at, like have you treated yourself and don't notice a difference, or what's going on?
I see a world of difference with myself, a world, and that's why I bought this.
Okay.
3 years of pain, and it's significantly lower, and my mobility is just
What are you treating?
a back injury.
Gotcha.
But I've had a C-section, I've had tummy tucks, I've had all in that region, 3 different surgeries. And
Okay. Have you stuck an electrode on your back and treated across your stomach?
I
Okay.
personally haven't tried that yet, but I want
Yeah,
to try it for my
that's
client.
the next thing you're going to do. And so not only are you going to treat the C-section, and I realize this is a guy and he can't have a C-section, but you're going to treat across here, but you're also going to go up and down like this. So we want to release. So you want to go back. You want to make like an X, go this way and this way, because this is going to help release all that deep abdominal stuff that's going on there. The other thing that's going to happen is because you've had those surgeries, your psoas muscles are going to be pretty tight, your deep hip flexor muscles, because you've been pulled into this position for so long. So they adaptively shorten. So there's an acupuncture point down on the second toe that's called stomach 45. It's where the nail, it's kind of at the corner of the nail down there on the outside. When you stick this unit on there, and start treating it, it is incredibly painful. So the point is ST45. So it's going to feel like you're driving a nail through your toe, but it'll give you a better release on your deep hip flexor muscles than you can get with manual therapy or yoga or stretches. It is very, very significant. So definitely do that. That's going to help your back pain out a lot, but after you treat the scars.
Did you say hip flexor muscles or just psoas?
Well, I mean, any of the hip flexors.
Perfect. Thanks.
Any of the hip flexors. So that should help you a lot. But you need to treat the scars first because you got to set it up so that it holds. All right. What other questions do we have?
I have a question.
Okay.
If I'm going to treat multiple abdominal scarring, some of it with that does not have scars visible,
Okay.
can I put the big grounding pad on my back over a laminectomy scar?
Sure.
Thank you.
You absolutely can. And if you've had abdominal surgery and you don't know where the scarring is, stick a pad on your back if you have one, and then just start pretending to see scars. Go up and down, go left and right,
Yep.
go under your diaphragm, go across your belly button, go low, make X's across there. You'll eventually pass enough electricity. It may take a while, but you'll pass enough current through there that you'll repolarize that tissue.
I have one other question if you've got time for a quick one.
Sure. What's the question?
Trigger points.
Okay.
I've been trying and I find that I can find them on my fingers.
Okay.
The rest of my body at my age has more fluff than muscle.
Okay.
And I am having trouble finding them anywhere other than on my, I can't find the, what is it, LI1?
Fluff is not going to interfere with your ability to find treatment points. What will is how hydrated your skin is. So if you put it on the dry setting and still can't find points, I would take a paper towel and wet it and wipe it over the area where you're looking for points and then dry it. And that will usually hydrate your skin enough that you can find points. Some people, as we get older, our skin gets drier. So that's definitely something that can happen. The other thing is if your electrolytes are a little low, so drinking some Gatorade beforehand may be helpful.
Great. Thank you.
Sure. All right, guys.
Can I have one question?
Sure.
Thank you. I was actually treated by someone with the Dolphin stin, and that's why I went and bought it. And they were treating me for plantar fasciitis, and it did not help at all. Have you found a success with that?
I have, but how do they do the treatment?
They were just working on points on my heel, like around the foot.
Okay. So plantar fasciitis is treating the heel can be useful, but if you let's look at standard physical therapy. Have you been to a physical therapist for your plantar fasciitis?
Yeah, a chiropractor, and yes.
Okay. So what do they tell you to do? They tell you to stand on the stairs on your toes and stretch this out, right? Like this, because that stretches all this. So that tells us that this stuff in here is a problem. So if you get this loose, so from a manual therapy perspective, you end up doing a lot of manual therapy here, not so much down here, because this is just where it's pulling, okay? So this is tight here. It's pulling on the Achilles tendon and pulling on this plantar fascia under here, but it's because this is tight here. But if we take it a step further and we say, okay, well, why is this tight right here? Like what are you doing to make that tight? So if you look at a dermatome chart, let's see if I can get this close enough for you to see. If you look at the back of the calf, you will see that says S1 and S2. So if we track that up to the back, you'll see that that actually goes to the first and second sacral nerve roots. So when I treat plantar fasciitis, I'm doing a treatment on the low back first. So essentially you want to do a low back treatment. Then you want to release the calves. And then you want to connect the calf with two Dolphin neurostems. There's a point right here called bladder 57. Connect bladder 57 over the sacral nerve roots. And after that, then you'll do some treatment down here. But this is the problem. When this gets irritated up here, it raises the levels of acetylcholine down that pathway. And this goes for any problem. Like if you have a hand problem or an arm problem, you got to treat the neck. If you have a knee problem or a whatever leg problem, you got to treat the low back, because when those nerve roots get irritated, levels of acetylcholine go up down that pathway. So whatever nerve pathway that is, acetylcholine is a neurotransmitter that makes muscles not spasm, but draw. It makes them contract. So as they start to draw, it pulls on things. It pulls on the muscle attachment points. And then you get tendons. Your tendons become what they call enthesopathy. And enthesopathic tendons are thickened and inflamed. So it tends to hurt a lot. You get tendinitis type feels and plantar fasciitis type things and carpal tunnel type stuff. But if you go back to the nerve roots, you'll see a lot of change there. Where do you live?
I'm up in Canada, in Ontario.
Are you anywhere near Toronto?
Yep. Yeah, I'm about an hour away.
Okay, well, these are made in Toronto, and the
Right.
main office is in Toronto. And the guy who designed this, he's a very busy man, but his name is Bruce. If you
Mhm.
call the main office and say, Joe Durant said, and maybe if I come by the office, you might give me a treatment or show me how to use this. Now, you might have to agree for him to film you for part of the tutorial, but
Right.
he's literally the guy who developed this, the guy who designed this is right there in Toronto, and
Okay.
he's very busy, but he's a super nice guy if you can catch him.
Okay, thank
So
you.
and I'll be up there at some point this spring teaching, but I mean, maybe you can get up, see him. And if he can't treat you, he's got somebody there that he can refer you to. Okay.
Okay, great, thank you.
All righty. Yes, somebody has a
Can I-
question there. Looks like that's Amanda was about. I saw this. All right.
Hi.
Yes.
So you're incredibly knowledgeable, and this has been really amazing. Thank you so much. If I wanted to do some more research about different pressure points and acupressure points, and the book's great, but I want more, where would you recommend that I look online or to find more to make myself more knowledgeable?
I mean, there are tons of free acupuncture guides online. Like you can Google up a bazillion of point things. If you want to understand acupuncture a little more, like the theory behind it, there's a book that's called The Web That Has No Weaver. Like that gives you some of the theoretical basis of acupuncture. Like if you really want to get deep in the weeds, like the guy in Canada who designed these trained under this guy. So you can look this one up. Clinical Acupuncture by Anton Jayasuriya. And this guy was like one of the first non-Chinese people allowed in the acupuncture schools in Beijing in like 1958. And he was a British trained surgeon, but he was from Sri Lanka. So he opened a school in Sri Lanka after that. And tons of European doctors actually went and trained with him. The guy wrote 50 books on acupuncture, 50. So this is a list of his titles. Sir Professor Dr. Anton Jayasuriya, like blah, blah, blah. Knights of this, knights of that. He was like the doctor at the Olympics in like 1976. Okay. So this is a good reference if you want to get deep in the weeds. And we do look online. We do have some courses online you can take. So if you're not currently in England, you were at one point, because I can tell because you have a different accent.
Indeed.
So you could actually take one of those courses. You could actually do one of those courses online, some of the online stuff, because our courses are really specific in terms of how to apply microcurrent to acupuncture points, concussion treatments, and how to do back treatments and neck treatments and stuff like that. And I know it's a bit of a trip for you to come across the pond and train with us, but there we do have this computer thing, so you could get online and check out.
Fantastic. Thank you so much.
All right.
Thank you.
All right, so after an hour and a half of this, the puppy is finally asleep, who was chewing up everything, including this pen and a whole bunch of plastic stuff I had to take from her. Well, she's asleep now that we're done. So anyway, I need to get the puppy together. I need to go home, and I need to get my kids to bed so they can be in school tomorrow. So thank you guys for coming out. You guys can certainly sign up and take this again if you want to. And to give you a chance to ask some questions. I may catch up with you guys on the Facebook forum if you see me there. I try and get on there some. Let's make sure I've got all the questions answered here. When treating internal scar tissue from laparoscopic surgery, when do you focus the treatment since the internal? Okay, we went over that one. Just treat the whole thing like a whole bunch of scars. All right, guys, have a lovely evening, and I will see you next time.
Thank you, Joe.
You're welcome.
Thank you.
Bye.
Yeah.